Good afternoon to one and all. Today I am going to present on the study of effectiveness of botulinum toxin for the treatment of acute acquired comitant esotropia. It is a rare ocular condition that is characterized by acute onset of esotropia associated with diplopia. During this COVID time, due to restriction of outdoor activities and increase of online classes, we have seen an increase in incidence of this condition. It is mainly categorized into three types, that is Swan type due to disruption in fusion, Burian-Francisci type, it is associated with minimal hypermetropia with often associated with physical and psychological stress, Belchowski's type which is due to uncorrected myopia and increase in excess near work. Other causes of acute esotropia is cyst nerve palsy, ocular myasthenia gravis, neurological disorders like tumors of cerebellum. Ours is a prospective study carried out between November 2020 to March 2021. It was done in patients who presented with acquired comitant esotropia and received injection of botulinum toxin to the medial rectus muscle of the affected eye. In these patients, a complete history taking was done with precipitating events, nature, duration, the medium of near work, and any history of any previous surgeries or use of glasses. Complete demographic parameters were taken into consideration. Ocular assessment include visual acuity, binocular vision status, and amount of deviation pre and post injection. Other evaluations like complete cycloplegic refraction and MRI brain and orbit was done. The criteria for selection was acute esotropia with photographic evidence of previously aligned eyes, comitant esodeviation with normal ocular movement, and a normal MRI scan. Botulinum toxin A injection vial consists of 50 units of lyophilized unit which was dissolved in 1 ml of normal saline. So 0.1 ml of liquid contained 5 units of the drug. All injections were given by the same surgeon using a 26 gauge needle transconjunctivally to the affected medial rectus muscle of the affected eye. All patients were advised to avoid gadget use and reduce near work. We had followed up patients 1 week, 1 month, 3 month, and 6 month post injection. During the follow-up, complete ophthalmologic evaluation including orthoptic evaluation and binocular vision assessment was done. The criteria for successful treatment was complete resolution of diplopia for distance and near, ocular alignment with twin prism diopter of esophoria. In our study, we had total of 15 patients, including 6 females, age group of 5 to 25 years with a mean age of 13.4 years. Our success rate was around 66%. That is, 10 patients were treated successfully. This is the Excel sheet showing the patients whom we had evaluated pre-op, post-surgery. And 5 patients had recurrence of squinting and we had advised them corrective squint surgery. This is a photograph of one of our patient pre and post injection 1 month and 6 months. All 10 patients who were treated successfully maintain a high grade of stereopsis of 120 seconds of arc or better. Ocular alignment was maintained even after 6 months of injection. The only side effect that was seen post-injection was mild to moderate of ptosis of the upper lid in 4 of our patients, which resolved within 2 months. Other treatment modalities available are use of prisms, which is difficult to wear as it causes a distortion of image, strabismus surgery, which is more invasive and causes muscle and conjunctival scarring and needs a long general anesthesia, while botulinum toxin it can be given transconjunctivally with no pain post-surgery, and it can be performed under short general anesthesia in children or topical anesthesia in adults. So coming to botulinum toxin, it selectively acts on peripheral cholinergic nerve terminals and it causes temporary paralysis, inhibiting the muscle. It causes changes in the length of the tension of the muscle, thus maintaining the alignment of the eye for 3 months, but long-term effects have been documented. The cause of recurrence after treatment remains an open question and needs supportive long-term studies for definitive answer. So advantage of our study, we have a definite role for this treatment of acute esotropia and we can avoid need of squint surgery and it is a safe and easy procedure for treatment and early post-operative recovery and patient comfort. These are my references. Thank you.
All of them maintained for 6 months.
Yes, ma'am. And we have followed them up after 6 months also. They are maintaining ocular alignment.
All of these patients needed surgery.
There were recurrence in 5 patients, and those patients we had advised surgery.
After how long?
We normally advise them surgery after 3 months of post Botox injection, so that the effect of the medicine is weaned off, and then we do a corrective surgery in recurrent patients.
You said you asked the patients to reduce their gadget use.
Yes,
Do you
ma'am.
think it was followed process?
I don't know, ma'am, because the patients who had recurrence, they had history of use of gadgets, so it's
Subjective.
yeah, subjective.